This is going to be a presentation on ethics in nursing. It was done by a group of us four. You can see our names here on the title page. Presenting on behalf of the entire group will be me, Marshall McCroskey. Let's get into it. So the scenario we have is a 22-year-old female patient who has come into the clinic for an exam. She's 28 weeks pregnant, Gravida 3 Para 1. She was given a full drug test with her consent and has tested positive for amphetamines. So this is the going to be the theme of the whole presentation, is we're going to examine ethics in nursing by analyzing the correct and incorrect behaviors for nurses in this situation. So what would our roles be? So the first bullet we have here is the role of the nurse in a situation like this is to refrain from showing judgment. We are in the capacity as nurses as professionals, and so our job is just to do our job. So what is our job? Well, prioritize the health and well-being. That's our priority. It's not about judging. And that also means advocating for the well-being, both of the patient, mother, and the child. In keeping with the idea of advocating for well-being, not only does that mean don't judge and providing care, but it also means providing education. And then, of course, there is also a legal aspect of this, which is reporting to Child Protective Services, and we will get more into that. So we did this slide on false positives for amphetamines. You can see here there's a number of drugs that create false positives. And so this is one reason among many why you don't want to be too judgmental. So, you rush to judge someone and it turns out to be something else. It's going to become a problem. Listen, as always in nursing, HIPAA always applies. HIPAA, of course, stems from the ethical framework that nurses and healthcare in general operates in. Now, in terms of reporting to child care services, that would not be a HIPAA violation, no more than it would be to discuss it with that woman's doctor. On the contrary, it's actually our duty to report when such things happen. So what is the law in California when it comes to illicit drugs with pregnancy? This is part of ethics. It's not just about our moral behavior, but we actually have to always act in accordance with the law. So what are the laws in California? Well, California's Child Abuse and Neglect Reporting Act requires healthcare providers to report cases where there is reasonable suspicion of child abuse or neglect. Testing positive for amphetamines during pregnancy may trigger such a report if it suggests harm or potential harm to the fetus. So we report it to child services and then they take it from there. So obviously the laws of the state are important, but there's also principles of ethics which may overlap with the law but actually have to do with our individual behavior. And so some of the principles behind these ethics are displayed here on this slide. So first you have autonomy, right? So that's the idea that every single human being is autonomous. We are our own sovereign person, and we cannot be and that sovereignty, that autonomy, cannot be violated by another. So what does this mean? It means respecting the patient's rights to make informed decisions, discussing the options with her and the treatment plans, and being really upfront with everything that's going on. Next principle of ethics is non-maleficence. This is basically like when the oath for doctors, do no harm, or the old motto at Google, don't be evil. Non-maleficence means not causing harm, so that's part of it. That's probably the most easiest and obvious one. And then the last one, beneficence. I like the definition here, the duty to act in the best interest of the patient. It's not just that we don't harm them, but we actually have to actively do right by them. So, of course, in this situation, that would involve educating the mother, reporting to CPS, because you're thinking of the well-being of both the mother and the child. So what about in terms of the American Nurses Association? Well, we've got here the three provisions of their code of ethics. So the first one is the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. So this is actually another way of talking about autonomy, right? It's put well, actually. The inherent dignity and worth and unique attributes of every person. Okay, provision 2. The nurse promotes, advocates for, and protects the rights, health, and safety of the patient. So this sort of is reminiscent of the previous concept of beneficence. Doing right by them, actively advocating for their well-being. Provision 3. The nurse has authority, accountability, and responsibility for nursing practice, making decisions, and takes actions consistent with the obligation to promote health. So this is interesting, and this is where the nurse's duty to report in that in our case study, the woman that tested positive for amphetamines. We have the authority to analyze those tests, and then we have the responsibility to report that test because a child is in danger. The accountability part is, actually, if you don't do that, you could get in trouble. So obviously the law is always going to be a part of it, right? Here's a couple of examples of torts that might arise from scenarios in nursing. So negligence is the first one we have here. And this is essentially just not doing what you were supposed to do. So as defined here, failure to follow the appropriate protocols regarding how to report the substance abuse by the patient would be considered negligence. This could be harmful to both the patient and the baby. By failing to report the situation with the amphetamines, or let's say by neglecting to report, that actually could result down the line in harm. So that could become a tort scenario. The next one here is battery. This one, in a way, is obvious and not obvious. Battery is when you physically impose in a physical way on another person. So usually you think of it as hitting, or fighting somebody. But you can see in medicine, there's a lot more nuance because we're actually interacting with their bodies constantly. So actually anything that you do to their body without their consent, regardless of whether or not it harms them per se, that could be considered battery. So for example, in that last situation, we mentioned specifically that the patient was tested for drugs with her consent. Why? Because had we done it without consent, that would legally be on the same terms as if we had physically struck her. And then lastly, false imprisonment. This is a big one in nursing because, there's often situations where you have to contain or restrain a patient for the sake of their own health. For example, if a patient who needs to have a trach tube in is confused and doesn't understand it and keeps trying to pull it out, they'll actually hurt themselves more by pulling it out. So then we're able to restrain them. Where that becomes a problem is putting a patient who gets up out of bed too much on restraints without a restraint order. So yeah, technically it can keep them safe in the bed, but at the same time, it's not our right to just tie people to them, to just shackle people to the bed. So as we put it here, restraining and pressuring the patient to stay for treatment will be considered false imprisonment. That's another thing. Even just physical intimidation. For example, in that situation with that woman, we tell her, we're going to call CPS because of your test. We don't have the right to physically restrain this woman or to lie to her, say, and make her stay in the room. That would also be considered false imprisonment. She has the right to leave if she wants to leave. Another thing worth understanding when it comes to the law is the difference between civil and criminal action. Primarily, the difference would be, criminal action involves being charged with breaking the law, committing a crime, whereas civil could just be in terms of liability. Doesn't necessarily mean someone broke the law per se. So some examples of this civil action. So this could be the kind of case that could arise with negligence or malpractice. If the substance abuse causes harm to the patient, to the newborn, that could be considered malpractice. If the patient or newborn are compromised in any way. And then criminally speaking, if the nurse failed to report, that might be, or if even the nurse covered it up, then that's beyond just, possibly being liable for something that happened from your actions. You, in fact, might have broken the law by doing something like that. So let's talk about the patient rights. There's actually established rights for patients. Here's an example of 3 of them that we'll present here. So the right to informed consent. The patient should be provided with how drugs can affect her pregnancy, potential risks that may occur, and how her current condition is. That's where the informed part comes from, right? I mean, if you can just ask a patient, hey, can I do this? Can I do this? Can I do this? And, chances are, just out of respect for the institution of the hospital or the clinic, they'll just say yes. But if you don't actually educate them on what it is you're doing and for what purpose and what the effects of that might be, it could be said that they did not have informed consent. The next one, right to confidentiality. So this is where HIPAA comes from, right? The nurse should keep the patient's medical history and substance abuse confidential unless the law states otherwise. Going back to that incident with the 22-year-old who tested positive for drugs, that's big time, gossip fodder in a hospital. But in fact, it is a violation of patients' rights. We all find ourselves in ugly places sometimes in life, and we should be able to go and seek medical care without worrying about being shamed. Last one we'll have here is the right to refuse treatment. The patient is able to refuse any further drug test and treatment from the clinic, but should still be informed of the risks. That's right. I mean, in the case of that mother, obviously we're going to report the situation to the CPS and they're going to figure out that situation from there. But in this scenario, she's really broken broken no laws. It's really not up to us to try and force her to do anything. We couldn't make her do that. Patient's rights supported or violated. This is like maleficence versus beneficence again. So supportive. The nurse should respect the patient's rights and serve as an advocate for the patient and their rights. They should also be providing comfort care based on their condition. Violated. Maleficence. The nurse should not violate the patient's confidentiality and should not force the patient to get treatment. The nurse does not report the substance use, then it is violating their legal and ethical duties. Okay, class. So this is going to be the last portion of the presentation, and it's going to be me giving you guys some questions to answer and discuss as well. So the way that I'm going to do this is I'm going to ask the question. I'm going to stop, give you a chance to pause, discuss, come up with the answer you want. You can play the video again and I'll reveal the answer. Okay. Question number 1. As a nurse, should we contact Child Protective Services to report the abuse that the newborn is experiencing early on? I'll give you a second. Okay. So the answer, this one should be very, very easy. The answer is yes. Absolutely yes. It would be negligent not to report it. It is literally our duty. Next question. What are some ways to approach the 22-year-old without being judgmental and still provide quality care? I'll give you a second. Okay, obviously this is a very delicate situation. There are techniques in our profession, therapeutic communication techniques, active listening, showing empathy, giving verbal prompts that encourage discussion rather than trying to steer it one way or the other. And as always, use your external resources like social workers, CPS. There's a whole system in place for these kind of situations. Okay, last question. Should the 22-year-old be charged with child neglect? I'll give you a second. Okay, so this was, of course, a trick question. And that's because it is not the nurse's duty to determine or even speculate on what a patient or even the patient in this situation is going to be charged with. Our job, again, is to do our duty, which is to advocate and maximize the well-being of the patients under our care. We do not pass judgment. So that concludes our presentation. We thank you very much for your time.